Who wants to write a blank check? So one of the major problems is we don't know who to hold responsible. Do we hold the federal government responsible or the provincial government responsible? So the provinces blame the feds for not paying enough, because starting in 1977 is where they stopped writing the blank checks. The federal government said no more 50-50 cost sharing. We're just going to give you a per capita funding, and they did a transfer of tax points. So there were some specific moves, but the bottom line is it wasn't a blank check. Before that, it was whatever the province spent on healthcare, the feds would pay for half of it. Well, in 1977, the first Trudeau government, with the Established Programs and Financing Act, said we can't pay for that anymore. And understandably so, right? Who wants to write a blank check? The federal government already got what it wanted. They had all this robust public health care in all the provinces, and then they refused to help out with it to the level that they were. And so that put the provinces on the hook. And so provinces were now forced to cut services, close beds. They started using hospital user fees. But the Canada Health Act was basically the point where the federal government put its foot firmly on the brake. 1977, they really stopped paying for things. And then 1984, they just said, no, you provinces have to do it exactly the way we're saying it, or we won't pay you at all. We'll claw back whatever you're doing in excess of what we think you should be doing. And so that's where Canada's been. We've been stuck in this cycle for about 30 years, closing hospital beds, decreasing services. There's been some regrowth in the 2000s, but it's been managed growth. So central planners decide what they think you need in your community, as opposed to you and your physicians and nurses deciding together what you need.